Hi everyone, thank you so much for joining us for another episode of House Calls. I'm Jennifer Galindo with Mission CISD, and I'm joined with Dr. Stinson from the Center of Primary Care and Wellness. So thank you, Dr. Stinson, for being here today and sharing your knowledge with us.
Well, thank you for inviting me again.
Of course, yes. So today we're going to be talking about a disease that is unfortunately very common. We all know someone who is dealing with it, whether it's a family or a friend. And this is diabetes. So, Dr. Stinson, can you share with us what is diabetes and what are some of the causes for it?
Well, there's two types of diabetes. The first type is type 1, not as common, but we still have a lot of cases here in the Valley and around the country. And that's the type where your body stops making this hormone called insulin. It's considered an autoimmune condition. In other words, your body attacks it. Problem is that you no longer have insulin in your body, so your sugars will go up because that's what insulin main function is, to lower your sugars to keep them under control. And we have to, for those people, we've developed a way to give them insulin from outside their body, and it's with an injection. And they've been doing that for decades. We've been treating type 1 diabetics since before I was born. It is a much harsher type of diabetes. There's a lot more organ damage that can come from it if it's not caught on, treated well. But it's again, when you get type 1 diabetes, you're on insulin, and that's all it really will help it. The common one we have here in the Valley is type 2 diabetes, and that's the one that we inherit. It's genetic. Most people with has any Hispanic or basically the Native American descent will have this in their gene pool. Not everybody, just because your parents have it doesn't mean you're going to get it, or maybe your parents, nobody has it, but you may get it. Okay. But it is definitely genetic. And it is a type where you have insulin. That's not the problem. You have plenty of insulin. Your pancreas is able to make it. In fact, you usually make too much of it. The problem is your body's not using it the way it should. Your body resists the effects of insulin. So I call it insulin resistance. It doesn't come on as hard as type 1. Type 1, your sugars go up immediately, and then a lot of people get hospitalized because they go up so high. Type 2 is a gradual onset. The problem is sometimes we don't catch them during the gradual part. We catch them, a few years into it, and their sugars are very high. But the point is that to type 2, as your body starts resisting the insulin, your body will make more insulin, and that kind of keeps your sugars normal for a while. However, that high insulin content does produce its own problem. It produces problems with your blood vessels. It'll cause blockage of the arteries. So there are consequences of your body's rise in insulin in the compensation period. But eventually that rise in insulin is enough and your sugars go sky high, and that's when people typically come and see us, and your sugars are very elevated. With type 2, we start off with medication. You don't use insulin to treat it because your insulin's already high. So we start off with a stepwise. There's a guidelines and protocols that we start off with, and the doctor is going to, be checking your labs and then adjusting your medications and to get that. But before you start medications, if it's just starting out, you really try to push the patient to change their lifestyle a little bit. You want to check that because some patients do very well. It's nothing they're doing wrong. They're just their genes. Other people, they have their lifestyle doesn't fit with what a type 2 diabetic should be living. They have high calorie intake. They don't do any exercise, and they're pretty much what most of us are. So most of our living is not it's not good for diabetes. So it's up to the doctor and the patient themselves to find out what they should be doing. And that change in lifestyle will take us a long ways for a lot of young diabetics. Again, eventually they have to be put on medications for that.
Okay. And I know you mentioned it's kind of a gradual process before they start getting on the insulin and medication. Are there any signs that, people should look out for where they're kind of like in between the stages where they're, need to get insulin or need to get treated for it? Kind of like the telltale signs that this may be coming if should they, experience any symptoms, stuff like that.
There are, but those are usually pretty late it's if you're getting signs already, you've had diabetes for a while on type 2. Type 1, it'll come in quick. They will start losing weight. They just start losing weight for no reason. They start urinating a lot. They get very thirsty, and that's one of the early signs that you get for type 1 diabetics early on. Type 2s, they don't get that till maybe a few years into it. The first months to a few years, depending on the severity of their type 2 diabetes, they won't feel anything. They feel completely normal. They have no idea that their sugars are rising.
It's kind of scary.
Yeah, exactly. And then eventually they will get the same thing. They'll start losing weight. They'll start drinking a lot of water. And that brings us to the point where a lot of people, I tell them they have diabetes, it's almost like telling them their reaction psychologically is like when you tell somebody you might have cancer. It's a very scary thing to have in the minds of the patients. They really, really are just almost in shock when they hear it. A lot of them, and it's because we all remember our grandparents are from the past where they were very sick and there's diabetes and it's horrible. And it was as bad as cancer back then. But that was a different world. We didn't have the medications we have today. We didn't have the clinics that we have. We have now a lot of clinics for people to get tested. We have, again, a lot of medications. We test at home better than we did before. We test at the clinics better. We can really manage diabetes easily now compared to what it was before. So if you were diagnosed with diabetes today, type 2 diabetes, it's not a big deal, really, as long as you take your medications. You're not going to get all those problems. You're not going to get the amputations and the kidney failure and the blindness. It's just not happening like it used to. It's a very different world. So I guess if you're diagnosed with diabetes, you shouldn't really be fearful of it anymore.
Yeah.
But you need to be now close with your doctor and your clinic to make sure you have it under control.
Yeah, and I think it's interesting that you mentioned how patients have that shocked kind of reaction when they hear, because I think some of it is there's that tie to my lifestyle needs to change. It's almost like, this something needs to happen to manage it. So what would you recommend? I know you're mentioning it's hard for people to get the knowledge of what they're supposed to do if they have it. And you always hear, right, you have to eat good and be active. But what are kind of like the baby steps you would recommend for someone to just, get started?
Right. So first, do a check on your diet. Okay. Let's say there's few things that you want to eliminate completely. One is sugary beverages. In other words, Cokes and those kind of things, sweetened iced tea, those kind of things. Use artificial sweeteners. That's okay. You can use Diet Coke or Coke Zero or Diet Dr. Pepper or whatever you want. But I just drink water. You no longer can be a candy person. You can't be every day going out and grabbing some candies and that's my little thing of candies. You can't be doing those. And that's what I really want. We need to eliminate that. Then you want to look at as far as what food can I eat. It's mainly you can't have big volume. That's what we really want to avoid.
Okay.
So
can't have the whole pack of
right,
strawberries.
Exactly. So you can have tortillas. You can have bacon, and you can have potatoes. You can have that, but small amount. You want a baked potato? Have half a baked potato stuff. But that's your meal, and that's done. A little small one, nothing else. You can have any fruit, just a small serving, just a serving like that. Having a big salad is not healthier than having a little half-baked potato. So there's a lot of things that people are told that you can't have starches, you can't have certain fruits because they have this certain index that these are bad for diabetes and good for it. So that's one thing. Just uh, understand that you have to have a decrease in how much you eat per meal. You have to do
Okay.
that. Uh,
Portion control. It's all
yeah,
about
yeah. In
portions.
1980, I didn't have to say that because we didn't have
Mm-hmm.
these big portions back in before 1990. Now I have to say that because people's meals are like this now. They think
Yeah.
people think this is the right size meal.
I know, I struggle with that too. It's like, well, this is healthy because I'm getting like a big salad, and
Right,
like, they're in the office and they're like, I don't, you're 2 packages of ranch. Like,
right.
I don't know if that's healthy,
Yeah,
but yeah, it's all about
we shouldn't be eating
portions.
restaurant style meals every day, twice a day. That was for special occasions, and now we do it all the time. So our meal size are abnormally big, and we have to readjust ourselves to say, look, let me go back to the normal human meal size, which is small. And then you have to start having your meals the traditional way of breakfast, a mid morning small meal like a snack. And I avoid saying snacks because people think of chips and stuff, and shouldn't this is I mean a small meal, and then you have a lunch, and then you have a small meal mid afternoon, and then you have your dinner, and then a little evening something in the evening, right before bedtime is okay, and that'll help keep your sugars under control. And we've been teaching that since the 60s. We understood
Mm-hmm.
that for the type 1 diabetics, that having to have 5 meals a day would keep the sugars easier controlled with insulin. And it's the same thing for type 2 diabetics. So it's very important. And as far as exercise, I would at least 30 minutes of a daily light exercise, which is light exercise is like a walk, just daily
Okay.
walk, 30 minutes minimal. I prefer an hour, but at least 30 minutes, and that does a lot. It really does. You see people's sugar start going down when they start exercising.
Mm-hmm.
They say, "Well, I'm active all day long. I'm on my feet." It's different when you're active on your feet. You're active, then you stop. You're active, then you stop. Doing a persistent 30 minutes to an hour does a lot of things to the body that will improve your sugar control.
Okay, so it's just finding that time from the day to just take a brisk walk
Right, like you
for
said,
30
that's what
minutes.
people kind of understand. Oh my God, diabetes! I got to do all these things that I just
Mm-hmm.
went over. And that's the other scary part of
Yeah,
that.
just breaking it down into, steps, baby steps that are doable. Hopefully, we can connect with some people today and they can, soak in the knowledge and hopefully make a lifestyle change and, impact a few lives. All right. Well, Dr. Stinson, thank you so much for talking with us today and sharing, your knowledge. And thank you guys for watching if you're still tuned in. And until next time, thank you.